Pharmaceutical drugs and how they affect your eye health. So when I was in my practice, every day people would come in and they'd be on a whole list of medications, and we would go through each medication to see what the side effects were, especially for our eye health. You know, pharmaceuticals only treat symptoms. They don't treat the causative factors, and because of their synthetic nature, they actually create more disharmony in the body and take you further away from your ability to heal. So we're on so many medications today. I would say two main ones are the corticosteroids and the antibiotics. And these two sets of pharmaceuticals can cause many problems. First of all, it's going to reduce your ocular microbiome in the eye, but long-term use of corticosteroids actually can cause things like intraocular pressure to go up, which leads to glaucoma, cataract formation, and macular problems. And in terms of antibiotics, that is going to reduce the ocular microbiome, and it's also could cause dry eye syndrome and light sensitivity. So I would get off those medications as soon as you can. Also, if you're on cholesterol drugs like statins, they've been found to cause retinal hemorrhages and bleeding in the retina. So you want to make sure to have a yearly eye exam and a full dilated retinal exam to make sure your retina is healthy. I've talked in other videos about non-steroidal inflammatory drugs like ibuprofen and Advil. And these drugs long-term can also lead to conditions like cataracts, glaucoma, macular degeneration, and retinal bleeding. So I recommend as fast as you can to get off those and maybe instead get into an anti-inflammatory diet, take lots of fish oil, probiotics, and get away from those drugs because they're not helpful to you. There are also drugs for weight loss that can actually create more inflammation in the eye, cause things like dry eye syndrome, light sensitivity. Another set of drugs would be the Synthroid from thyroid imbalances. This can also cause light sensitivity and dry eye syndrome. So if you take a look at all the pharmaceuticals that you might be taking, I would do some research to find out exactly what the side effects are before you start taking them. Case in point, I had a patient come in a few months ago who was diagnosed with open-angle glaucoma, started taking glaucoma medication, and it started to create heart palpitations, dry mouth, difficulty sleeping. So we started to change him off of that glaucoma medication by giving him a lot of eye vitamins and fish oil, using MSM eye drops, getting craniosacral therapy, and we were able to get him off that glaucoma medication, and these side effects went away. In fact, his eyes actually got better by getting off that medication. His visual field improved, and a lot of positive things happened. So my advice would be, if you are on medications, find out what the side effects are and move towards a more holistic philosophy where instead of treating symptoms, you're trying to find the causative factors and get off these pharmaceuticals.